That you're like pretty much start.
All right. Looks like we have a couple people coming in. So we'll just go ahead and get started. Hi, everyone. I'm Emily Moore. I'm one of the co-project managers of the Southeast MHTTC. I want to welcome everyone to the second session in our perspectives, our peer perspectives series. We had our first session back in October, and this is the second one. And I'd like to encourage everyone to also attend our session in December. I will share more information about that at the end. But without any ado whatsoever, just in the interest of time, I want to go ahead and turn it over to Roz and Jay and our panelists. And I will be back at the end of the session to share our SAMHSA required evaluation links. So Roz and Jay, go ahead and take it away.
Thank you so much. So the prevalence and the impact of trauma is undeniable. Statistics show that as many as 90% of the people who enter into the public behavioral health system have experienced trauma. The Adverse Childhood Experiences Study, also known as ACE, demonstrates the correlation between early childhood adversity and negative health outcomes in adulthood, including heart disease, cancer, substance use disorder, and mental health challenges. So today is our second part of the three-part series on trauma and the peer perspective. On today's Hour of Power, we'll be able to look at trauma and 988 and crisis services response. So everyone is familiar with 911, right? 411, and probably even heard of 211. But what about 988 and suicide in the crisis lifeline? 4 years in the making, 988 is now a national reality, and trauma is very often the catalyst for crises, and providing trauma-informed support is critical during these crises. So like with any webinar, it is our hope that you will walk away from this learning something. So we have a few learning objectives that we're going to cover today. The first one is you're going to learn what's working well with 988. We always try to approach things from a positive, what's working type perspective. So we're going to learn what's working well with 988. We're also going to gain insight on what could be different with the 988 suicide and crisis line. And then last objective, we're going to understand ways that 988 responds to trauma. So my name is Jay Hughes, and I'm a person in long-term recovery. And what that means for me, I've not used any drugs and alcohol in a very long time. And I'm also a person that struggles with substance use disorder, but also mental illness. And what that means for me is that I have a life where I'm actually able to be present, not just there, but be present, and to be able to even help my daughter at 19 make some decisions. She actually listens to me. Sometimes. And I believe that this recovery pathway is so large and expansive that anyone can travel regardless of the path that you choose. So welcome again today. And with my partner in crime, but not crime, but my partner in this work, Rob, please take it away.
Thank you, Jay. Thank you. And welcome everyone. My name is Rosalind Hayes, and I'm a person in long-term recovery. And what it means to me is that I do what I need to do on a daily basis to be able to suit up and show up for my life. Today, I walk my dogs. I am a daughter that my mother is proud of. And, you know, according to my nephews, I'm the coolest aunt ever. I'm also the director of training at the Georgia Mental Health Consumer Network. And I have lots of experience. I spend a lot of time working on the peer-to-peer warm line and have lots of experience taking phone calls. And I know how important it is to have someone to call. And equally as important, if not more important, is how that person that I call responds. And so thinking about 988 and recognizing trauma as a catalyst for a lot of the distress that people experience, it is important that we do not re-traumatize people, that we do come from a trauma-informed approach so that people are not re-traumatized when they're in that moment and they're reaching out and they're making those phone calls. And so I'm excited to learn more about 988 today, and excited to have this group of experts here to share about 988. And so with that, I'll ask each of our panelists to introduce themselves. I'd like to know your name, your organization, and your relationship to mental health recovery. And so we will start with Bev and going around the board.
Good afternoon, everyone. I'm Beverly Ragland. I am the program manager for the Georgia Council on Substance Abuse Care's Warm Line. My relationship to recovery, I'm in recovery from substance use disorder and mental illness. And so in recovery from Amazon Prime, I do my best not to order every day.
Thank you, Beth. Thank you for being here. Colette, tell us who you are.
Hi, everyone. My name is Colette Cormier, and I am a peer-to-peer warm line certified peer specialist working for the Peer Support Wellness and Respite Center of Colquitt County. And I am a person in long-term recovery from substance use and mental health challenges. And I'm just happy to be here today.
Thank you, Colette. Jean O.
Yes, ma'am. Beverly, hang on to your hat. If you got the Prime thing going on now, it's holiday season.
Absolutely.
Afternoon, everyone. I'm Jean Olszewski, and I am a woman in long-term recovery from substance use and mental health. And what that means for me is I get to be a part of my family and active in it. I live in Georgia, but I'm currently in Michigan, where I'm from, celebrating one of my brothers. Had a couple functions up here, and it's just been absolutely glorious to be able to connect. A little tiring, but really, really nice. I am Director of Recovery and Advocacy for Beacon Health Options. We're a part of the Georgia Collaborative ASO. I am a CPS and CARES 13, y'all. Thank you, Dr. Reverend Wendell.
All right. Thank you, Jean. Thank you for being here. And Mr. Wendell Fields, tell us who you are.
All righty. My name is Wendell Fields. Oh, God, dog. I like saying that name. I like it. Let me say it one more time. Wendell Fields. Oh, man, I felt that in my lower back, y'all. I felt that one. Boy, let me tell you, I represent one of the bestest, I say the bestest crisis intervention services you will ever find. It is called Behavioral Health Link. It is the Georgia Crisis and Access Line. I tell you, I'm the community liaison for them. And let me tell you, I'm a person in long-term recovery. That's right, long-term recovery with depression and alcohol use. What that means to me, ladies and gentlemen, I haven't touched that alcohol in 32 years, but guess what? Guess what, though? I've been working on recovery for only 5. And it's been the bestest thing I could ever do for my mental health, social well-being. I mean, the whole gamut of stuff. And so it's an honor and a pleasure to meet you all, to see you all. And CARES 47 is the best. I just want y'all to know CARES 47 is the best. Yeah.
All right. Thank you, Wendell. And we're going to roll on with it. And you know, I know 988 is a relatively new. I think it's been operational for what, about 6 months. And so, Jean, I'm going to throw this to you first. For those that don't know, explain to us exactly what 988 is and maybe what it's not.
So, all right. So 988 went live July 16th. So it's only been a couple of months. It has been in process from, it's a federally mandated program that, you know, everyone recognizes that 911 works, right? That if you have a medical emergency, you're in a, you know, God forbid, a car accident, you need the fire department to show up or whatever it is, you call 911. 988, with the emphasis changing in the United States, thankfully, and stigma breaking down, recognized that the government recognized, and many advocates as well, I should say, recognized that we need to really break down that stigma and offer crisis services and online support services to those that may be experiencing a mental health, a behavioral health, or suicide ideation. And that is a 988. Again, it went live July 16th. That being said, 911 took 30 years to completely roll out. It's still not, I think there's still a couple areas in the United States where it's not out. So there's a 3-phase rollout for 988. It is, it's going to, as I said, it's going to be breaking down stigma. It's people can call for themselves, they can call for others that they may be concerned about with mental health or substance use challenges. It's answered by licensed clinicians. There's a whole background to it. There's what it is not is again physical health. You can get resources. There's still a lot of information coming out about it. Georgia, thankfully, once again, is leading the pack in the majority of the states because we've had GCAL, the Georgia Crisis and Access Line, for so long in this state that we were able to pivot relatively quickly to be able to start the 988 program. It is a text and chat as well, and mobile crisis when needed.
Thank you, Gino. You definitely covered a lot, and we appreciate that. I will go ahead and give it to Jay. It seems that Jean probably answered the why we have it. And so I'll pass it off to you, Jay, with the next question. And we have another expert that we're trying to get on board, Mahogany. So go ahead, Jay.
No problem. So thank you for that, Gino. So the next question is, and I'm gonna ask Bev this. So Beverly, what do you know, or share with us, what was the catalyst for 988? Like, why was there even a need for 988?
Well, the main reason that I can initially think of without reading the literature related to it is the fact that too many times someone would call 911 and an emergency responder would come and increase the trauma that was going on in the situation that was basically a behavioral health situation. So it was recognized nationally, and so therefore nationally a 988 number, 3-digit number, was created in order to connect our peers to support services. So it's an opportunity for someone to have someone to talk to when they call the national number and around to their state number, someone to talk to. And if it's identified, then they can further talk to one of the warrant lines that's in the area. And if the need is for someone to respond, then they would make arrangements to dispatch someone from a crisis team to that area. And then again, the other resources, what are we going to do after we talk to someone and someone's responded to us, where we can go for help? And that's going like to a crisis stabilization center. So that's the reason, is in order to create opportunities to support behavioral health without traumatizing those of us that have these challenges. So again, it's to improve access to mental health and behavioral health services. And because of the increase in the number of suicides and the many challenges that have occurred basically related to living, but COVID on top of living, and all the needs that we have as being a community of those that are trying to appreciate the value of overall wellness. So in order to connect to these resources.
Thank you, Bev. Did anyone, one of the other panelists, want to either piggyback on what Bev said or offer any more information about the catalyst for? Because Bev did a good job explaining it. I just want to make sure that if any one of the other panelists, and just this for all the questions actually. So if we ask a question to specific panelists and one of you all want to say, hey, I got someone want to add to that, please be sure to jump in. So
I
thank
do
you
want
for
to
that.
mention the fact that it's so important to understand that the value, as opposed to being 911, it's they respond to emergencies and things such as that. And if there's no need for an emergency responder to come there and save a life, escalate someone that's in imminent danger, then like I said, it's a much softer way of connecting to resources that are behavioral health.
Awesome. Thank you, Val.
Right. And it looks like we have Mahogany Ellis. Thank you for being here.
Yeah.
Please tell us who you are, who you're affiliated with, and your relationship to mental health recovery. If you know, are you an ally or yes, thank you.
Absolutely. So my name is Mahogany Ellis. I work with DBHDD, Department of Behavioral Health and Developmental Disabilities. I am crisis coordinator for the Office of Crisis Coordination. And so what we do in my department is that we oversee the crisis system within the state. And so 988 is a huge part of what we are doing. I am fairly new to my role, but they have been working on 988 for the last 2 years, planning and implementing to get it started. And so I definitely can have some feedback and some insight to what's going on with 988 that I hope I will be able to share here in this discussion. And I'm super excited to be here. And I'm not in recovery, but I'm definitely an ally of it. I think everybody has some type of connection with recovery, and my father is in recovery. So I definitely have a different experience with substance abuse that I definitely am absolutely an ally of recovery as well.
Thank you so much for being here. And I'll go ahead and start with you, Mahogany, with how do people learn about 988?
So part of why I think a lot of people don't know about 988 is because we are kind of following the guidelines from the federal government and SAMHSA of not mass marketing 988 right now. And so right now it's really just through word of mouth about 988. Mass marketing will probably begin spring of next year. And so right now what we're doing is really engaging key stakeholders, right, of those communities that we know are at higher risk. And so we're making sure we're reaching out to those communities to make sure that they know that we are here. And so if they do need those resources, that they can access those. There is a website, which is 988ga.gov, that anybody can go to and get information about 988 as well. And so not even just for the individual, but for agencies and providers as well. There's one-page information, one-pagers that can be printed off that people can access to get more information about 988. There's also a brief little webinar animation that really breaks down how 988 works. It's a very short, like 4-minute video that I think really does a great overview about 988 and is very helpful and insightful as well. So those are the key ways, kind of that we're putting the information out currently right now, but definitely next year, there will be a lot more marketing about 988 to ensure that everybody has the knowledge and information about it.
And if I can piggyback on that, Mahogany, I'm with ASO. So I was on the Crisis Jam call yesterday, which is a national, and anybody can join that call as well. It's been going on a couple of years now. It's a fabulous, quick-paced hour every Wednesday at 12 p.m. Eastern, and brings in so many different stakeholders and really built the foundation of 988 across the board. But they had a presentation yesterday from the Ad Council. They're the folks, the federal folks that put out, Smoking the Bear for us old school, the really cool. And I think this is your brain on drugs from, the frying pan and all, but they did quite a bit of research regarding particular demographics and populations that 988 would be probably pertinent to it initially, BIPOC, LGBTQ, the older population, and really trying to identify why they may call, and the younger population too. So they're going to be rolling out an ad campaign specific to those populations, promoting 988, as Mahogany said, probably spring or a little bit later next year.
Thank you, Jane. Thank you so much for that. I was on the phone with a friend of mine last week, and I was preparing for this. He was like, "Man, what you working on?" I'm saying, "Well, doing this panel with 988." He said, "They got a new law out." I was like, "No, man, 988 is the number. Like 911 is 988." And he was like, "I ain't heard nothing about that." So now I can tell them that there will be some mass marketing about it more, so more people can know about it. So thank you both for expounding on that. Brother Wendell, so when you think about 988, what is working well with 988? We always like to approach it from a strength-based perspective. So what are some of your thoughts about 988 and the things that's working well?
Well, like you said, it's going well. We still have challenges, but you know what? Our people are receiving the resources that they need. When I say that, they're getting the support, they're getting resources, they're getting connected to various, when I say various needs that we probably wouldn't have if we didn't collaborate with one another. And the company that I'm serving, they're doing a wonderful job. When the call centers come in, when the call comes in, call center answers, and you got those licensed counselors on there, they're really thinking the difference. They're listening. And then after listening, they're connecting. So that's what I can say about what's going well for them at this point and at this time. So just thank you for that.
Man, thank you. Thank you.
I was going to say, I would add, right, I think what's going well is, right, that people are getting the help. We have a lot of data analytics out there to really see what's going on and help us identify the populations that we need to touch, but the volume is increasing from year over year, and we can see that, right? So we know that the volume is increasing with our GCAL, people calling the crisis line, and that's not going away too, by the way, as we do have 988. So I just want to make sure everybody is aware of that. But I think it also, what's going well in my view is that it allows us to really see the work that we need to do to really improve the system even more. And so allowing us to have better eyes and scope of where the gaps are to improve this process even better. So I think for me, it really highlights where we are, but it also highlights where we're going. And I think I love that vision that I see for 988.
Let me say this to piggyback on what you're saying. Now, in the call center, you all, it has gone like from 400 calls to 800 calls that we're getting. So we're doing something right, you all. We making it happen. We doing something right. And in that, it is helping people to understand, okay, this is a mental health crisis, substance use crisis, developmental disability crisis. Okay, we sort of get in the picture, but hey, just last week at the Out of Darkness walk, people didn't know about that 988 still. And so we're getting that word out. But those calls, y'all, 400 to 800 calls, woo, got me sweating already. Got me sweating.
Don't sweat it out, man. Don't sweat it out.
So Jay, if I may, I just want to also add to piggyback on Wendell and Mahogany that being able to really take the time and learn from, COVID and, the crisis lines that are in place now. And as Mahogany said, one of the really big benefits that I think, and speaking for DBHDD, is that it's really going to be able to put a spotlight on who really needs and is searching for help, whether it be rural and what populations and what they're asking for. as opposed to those that, I don't know the percentage of actually that walk through the doors of a CSU or a CSB or what have you, or an RCO for that matter, or it goes through the law enforcement system, but really see it from the front end and then be able to put the dollars and supports towards that. And also Morehouse and the Kennedy Satcher and Beacon Health Options has collaborated to make sure that equity is embedded across 988 nationwide. Patrick Kennedy, the senator, and who's in recovery as well, and David Satcher is a former Surgeon General of the United States. So, and Morehouse Medical School. So there's, and of course, Beacon plug. But so there's a lot of really, really good things coming out of this.
All right.
I
And just
also
real
wanna
quick,
mention-
just
I'm
real, hold
sorry.
on, just 1 sec, Bell. Just for clarification purposes, Gino, when you talk about CSB, RCO, what are those exactly for those that don't know those?
Okay, so the CSUs are the crisis, crisis.
Stabilization units.
Crisis stabilization unit, thank you. And the CSBs are the community service boards. And those are the safety net providers for the behavioral health system in Georgia.
Thank you. Bell, what you have?
Yeah, I just want to commend the coordination between the 20+ crisis, the committees throughout the throughout the state that are coordinating the training efforts and the connection efforts. Also, the deliberate efforts for diversity to reach out to the veterans, the older adults and immigrants, and those many diverse backgrounds, including rural areas and those communities that are not normally reached through all the efforts. But the fact that the training was given earlier before the rollout and ongoing training all along the way to make sure that we're doing this uniformly and professionally, I think that's really some of the things that are working well with this.
Wow, thank you. Y'all think that thing going good. Yeah, it's like there's a lot of intentionality. Go ahead,
Yes,
Rob.
yes. Thank you all. And on the flip side, with anything that's new, there are always challenges, and no matter how much we plan, we can't see everything. And so, what are some of the challenges that 988 is experiencing? How could it be different? And what is some of the public response then? I mean, I know I heard the numbers have doubled, but what are some of the challenges that y'all are experiencing with 988? Start with you, Mahogany.
Well, I mean, I think something that across the board in kind of every industry in the United States right now is staff shortages, right? So I think that's one of the biggest challenges right now for 988, which I think is also, that's part of the reason why mass marketing is not happening, because I just don't think we would be able to address the capacity right away. And so as we rev up to do that mass marketing, we're working on trying to figure out creative, innovative ways to address the staff shortages. To ensure that the people get the services that they need. So I think that's probably one of the biggest challenges that we're facing right now with 988.
And hand in hand with that is not only the staff, but there are shortages such as resources. Where are they going? The lists are so long that if we identify a place, how long can they wait before they go into an actual crisis? So I think we need more respite opportunities, detox centers and treatment centers, and of course, more opportunities for recovery initiatives.
Thank you, Bev. Jean, did you want to add anything to that?
I sure do, Rosalind. and Bev, you're correct about adding more services to the infrastructure that's already in place here in Georgia. And there's funding, they're searching for funding, or I don't want to say searching, but they've identified the funding amounts to increase beds, to increase those that may be need an assessment or what have you. And also, and Jay, the BHCCs that are coming down,
Okay.
behavioral health, community,
Make it up.
I'm just going to get a bunch of letters and mix them up. But the CA, I'll look it up. Behavioral health. I'll look it up.
Crisis centers. The BHCCs?
Yes. Yes.
Behavioral health crisis centers.
Right. That's they're coming down. There's I think there's 5 now in Georgia, and there's a new model. That's a new model that will be for lack of a better explanation, a one-stop shop. But some of the challenges that people have been experiencing, and it's been kind of caught fire by being online and social media, not necessarily in Georgia, but across the United States, because again, this is, a nationwide rollout, is BIPOC communities and underserved communities, youth that maybe or transgendered, LGBTQ that are homeless or whoever, being afraid that the immigrant population, being afraid that they might be turned in or, taken into law enforcement or something of that nature, or that, sirens are going to come, wailing down the street. At this juncture, 988 is not geolocated, so it is not identified. You can choose to identify yourself and your location. Obviously, if you're in imminent danger of harm, they're going to, request that you identify your location, and would most likely transfer you to 911 in that regard. It's about saving lives, right? But from my perspective and what I've been following is that, a couple people experienced this, and I shouldn't say a couple, and then not to discount that by any means, but others caught on to it and didn't have any personal experience with it, but just started sharing. We know that this is real. But it's identifying too, to make sure that everybody is trained in, what we're talking about, trauma-informed care, and not re-traumatizing. It is new. It's, we have the opportunity to, here in Georgia, to really take the time to offer specific trainings and insights to law enforcement and responders and the mobile crisis and all. So it's I see it as a double-edged sword, but we have opportunities with it.
I'm so glad y'all published the web link for the 988 Georgia, because it does have fact sheets and all kinds of information. If you go there, but she can be a PhD in 988. And that's wonderful, because getting the word out and having knowledgeable word is key to how this is going to be a success. And that's, again, I'm so glad for having this opportunity to share the knowledge that we have and the number of resources that are available to learn about this, so that it can be a successful national and statewide initiative as it is designed.
And then also with the website, if you have a question that you don't see and that you want answered, you can actually type it in, and then we'll respond to you get a response to that question as well. So the website is updated often, because as we're developing stuff, we put new stuff, on the website. So if you checked it once and think I checked it, printed off everything, that's good. No, go back and continue to check it, because information will be updated. And then I did also want to add, Rosalind, to your question, like some of the challenges or some of the things that we're hearing from the people is that if I call 988, I'm going to be, committed, involuntarily committed if I call. And so, that's definitely one of the larger myths that we hear, and that's absolutely positively not true. If you call 988, sometimes that's the intervention in itself, right? 988 doesn't always have to end up that you go into a crisis stabilization center. Sometimes you just need to speak to somebody and just get it off your chest and debrief and right. And so that in itself could be the intervention. Sometimes you just need resources of where to go, get connected to a therapist or some type of outpatient provider or medication, right? And we can assist with some of those things with 988. And so I think the biggest thing is understanding that as licensed clinicians, and I am a licensed LPC, there are certain criteria that needs to be met for us to what we call right 1013 or involuntary commit somebody. And so if you don't meet that criteria, you're not going to be 1013 or involuntarily committed. And so I think that's one of the things for people to know is that 988 does not automatically mean you're going to the hospital. That can mean we're just going to provide you some resources and maybe you just need to talk to somebody as well.
Thank you. Thank you so much for that. And I think for most people, in my experience, people just want to be heard oftentimes. Oftentimes, people are not really looking for you to fix them, primarily because people ain't broke. So I think being able to have a crisis line where people can call and be heard, and not only be heard, but also I don't want to trivialize it to just being heard, but also to be able to be linked to resources and to have adequate resources, but also making sure that it's trauma informed, where voice, choice, trust, and a peer perspective is acknowledged, which leads me to my next question. So what trauma specific training have 988 responders received? And what measures are in place to make sure that folks, when they call 988, they're not re-traumatized? And I'm gonna throw that out. Who want to take that one? I'm looking at everybody's face, and it's a good one. And I like all y'all beautiful faces, but I need a response. Who can take it? I want to hear from all y'all.
And we're going to go with the baseline. But first of all, when you call 988, you're going to get a trained counselor. And in the state of Georgia, you're going to be provided to a clinician who's going to make an appropriate determination of the resources that you need to be added to. But then again, we're going to talk about which discipline has training, and one of the most invaluable training I know for recovery is our trauma-informed care training that's provided funded through DBHTD. Also, the training is just key to understanding, first of all, that the reason for it is to eliminate further traumatizing. So the training is specific so that you have a friendly person. That's part of training, how to be that. A person who can make a positive connection and provide the necessary support. So you have to be knowledgeable of the resources that are available. So again, it's specific, identified, and purposeful training in order to provide the excellent services that our recovering community need, whether it be clinical recovery, or whatever pathway that they want to, and embracing all of that is so important. And doesn't have to have a certification or a degree, but that sure is helpful to have that knowledge base and to have the validity of the services that we're doing, so I think that's so important for the training. That's really key.
Thank you, Bev. Anybody else? What specific trauma training have 988 responders received, and what measures are in place? Thank you, Bev. Thank you for unpacking that. Anybody else want to throw a little something behind that? Raise your hand. Oh, yeah, there you go, Wendell. What you got, brother? Damn mahogany.
Well, I just want to say with GCAL and everything, we have fully licensed clinicians that are trauma-informed care recipients who understand that. So they're not going to try to jeopardize, they ain't trying to re-traumatize anyone. They will listen, and they're going to be quiet and listen. But yet also, they're going to do an assessment over the phone so we can hear what's going on, get the specifics of the situation, hear them out, and then we're going to say, well, these are some options that we can provide you. There go the resources, there go the supports. We even have the mobile crisis team option that will come out and do a face-to-face assessment with the individual, and then go from there to helping them either with resources or supports. But yet also, if they need help with getting to the hospital, we might not provide that type of transportation service, but what we do is a warm transfer, meaning that if they go by ambulance, if they go by friend, family to the hospital, we can follow and be still a part of that process by verbalizing, hey, what the individual is going through. This is what we saw. This is what we heard, and really help that person to get the services that they need. And then also, some people don't like us to come, but yet we have that app, the MyGCal app, that allows you to text, that allows you to chat. Yeah, and that'll get that phone call going for you too. So, you know, we don't want nobody to feel left out. We really are here to help you and get connected to what things you need to help you in your crisis situation.
Thank you. Mahogany, what you want to add to that?
Not much. I think he hit it right on the head, right? You have licensed clinicians that are operating these phone calls. And so part of that training is the trauma-informed care. But I think, you know, in general, as a whole, agencies are recognizing that there's really helpful benefits to making sure that your staff, not just your therapists, understand the impact of how trauma-informed care can really help, you know, keep everybody calm in a crisis stabilization center as well. And so there's definitely a push. I think agencies and CEOs of agencies are recognizing the importance of that and really stepping up to the plate to make sure that they're implementing training opportunities for their staff to really be trauma-informed and be really mindful of the different traumas that we go through as individuals and how that can impact your interactions within everybody on the day-to-day. And so, you know, training the techs or the, you know, mental health associates, as well as the case manager, discharge planner, the janitor, right, the cook, having everybody really understand how that really informs care and how it impacts the day-to-day.
I think communicating with our community partners, speaking to each other about the work that we do. We have a relationship with GCAL. I've been to GCAL. I call about a weekly basis and talk to Ms. Moore there to make sure that we're doing the warm handoffs in the way that they should be done. If there's not enough crisis, then we'll stay on the line and do the warm crisis, or if they're going to be transferred from GCAL, that they know that they're not be in space, but they know that they're going to be talking to someone that's going to support them in whatever their needs are at that time. So I think open communication is really a valuable part of training, knowing what each of us are doing.
And I agree with that. And I think that also Georgia, once again, is leading the way with DBHDD in trauma-informed care training, right? You know, we started with peers, and of course, as everyone said, clinicians are trained in that, and across the board with, as Mahogany said, building out the trainings within, you know, the CSBs and CSUs as a whole. Also, I think nationally, it's coming across with equity. You know, as I mentioned with Kennedy Satcher, you know, and Morehouse, you know, it can be baked in, if you will, from the start. And again, you know, Georgia, because we've had GCAL so long, there's other states that have not even had crisis lines. So they're starting from the very, you know, like, well, do we use dial-up phones, you know, and like that. So many people have been coming to, you know, DBHD as the SMEs and the so baking all that in and using the knowledge that we have. Of course, there's room for more, and it goes to community partners and all that Beverly was saying, you know, the warm lines, and peers themselves, you know, giving feedback that may have called, or family members, whoever it may be.
Also, law enforcement, our medical professional communities, and the schools and colleges. It's so important to get it out there to as many people and to have them trained, and that the service is available and exactly how it works. Because I can think of a time maybe a law enforcement officer may come and say, "Oh, this is not me. Let me dial 988 and let's do the appropriate connection to get the crisis people online instead of doing the intervention that an emergency responder would normally."
Thank you so much. This is a huge knowledge, huge wealth of knowledge that we have here on this panel, and I really appreciate it. And thinking about peers in our warm lines, Colette, start with you. How has the implementation of 988 impacted the call volume at the peer-to-peer warm line, and how do those calls that you receive, how do those differ from the typical calls you receive on the warm line?
Okay. Yes, I have seen a great amount of increase in calls coming through the peer-to-peer warm line, coming from the 988 number. And I think it's great because it offers us more connection peer-to-peer wise with people that do need to just be heard, and we're able to support them. What I see differently with the calls is there is a lot of peers that get transferred to us that are in rural areas and don't have access or don't know of resources that are out there. And it's a great opportunity for us to inform them of not only the peer support, wellness, and respite centers that are in the areas, but also get them some information about what other behavioral health or anything that can help them get some sort of support that they need. So the connection of getting them and informing them of our peer-to-peer warm line directly, so that they have somebody else to talk to, because they can get, in essence, 2 calls a day to 5 centers. And that really opens up an opportunity for them to have a lot more support, because a lot of times they don't even know about our peer-to-peer warm line. And that's just another hand in what 988 does. And that's what I see as a lot of difference. But a very big increase in calls. I take a lot of calls from 988 during my shift. And a lot of times they're just some of the difference that from the normal calls that I get. Sometimes they do have that suicidal ideation, or they're in the crisis from a trauma is more prevalent during those calls than some of the other warm line calls that we get. So those are some of the differences that I see, but it's just an opportunity for us to just really support them where they're at. And I'm really grateful that 988 transfers over to us so that we can support these peers further.
Thank you so much, Colette. Bev, do you want to add to that? And then we'll come to Brother Wendell.
Well, it's my understanding, I'm not directly on the line, but my staff has indicated an increase of all transfers from the GCAL, which is, I think, the route of the people that are coming in. And of course, they know, because normally the clinician stays on the line and says, I'm transferring them, or the peer will say I was transferred because from GCAL. And it's an opportunity to recognize that a warm line and a warm transfer is important in keeping them in averting a crisis. And so we are getting more and more calls, and of course we don't have enough staff, but we're working on that. But the fact of the matter is that it's great that the 980 initiative is there so that we can identify those that have the appropriate resources, whether it's an opportunity to further talk with a warm line couch, or to get the other services that are warranted for a more intense needs. So yeah, we've got a lot of thoughts coming from this 988 initiative. And I'm looking forward to our warm line going 24/7, because the call's going 24/7. We get messages on that they come to work that morning, get all these messages that they were transferred. And so I'm really, really busy working on that, because there is a need. And it's a need to keep from crisis, to keep from suicide, to keep from all of the things that happen when connection is not achieved.
Thank you so much. Wendell.
Well, I tell you, listening to Beverly and everything, I'm just sort of like, man, who would have thunk this a while back when I was coming up in the mobile crisis team? 27. Yeah, I came in there in 2007. And the things that we're talking about, it wasn't there necessarily. And with the warm lines, it's amazing how they've grown and gotten better. And even with the CARES warm line, who would have thought that you would have that 24/7 person to talk to about substance use? Those are the type of services that GCAL really does connect people with, to those 24-hour type of warm lines, to other supportive lines that can help them in, like you say, I just need someone to talk to. I got to get this process out so that I can hear myself sometimes talk about it. And oh, thank you. You know, it's just a totally different way of doing and seeing and helping someone. And the care lines, the peer lines, all those things are able to be accessed, and we help out with that linkage to them. So
Thank you for saying that. And I always want to tout the fact that they're professionals. They are trained in motivational interviewing, intentional peer support, appreciative inquiry. They're professionals, and they do the calls and make those connections in a way that will encourage the peers to follow their pathway to wellness and avert those hospitalizations. I want to community organizations, the respite centers, and all of these opportunities to keep from being hospitalized and being further traumatized are in place. And I really appreciate what we're doing as a state.
Thank you, Beth. Go ahead, Jean.
I just want to add things. So when I first moved down to Georgia, I started working at the Peer Support Wellness Center in Decatur, where it's greater, y'all. It was on the warm line. One thing, and now, you know, part of the ASO, the Administrative Service Organization for Beacon is GCAL, right? They're part of our umbrella contract. And I was in a meeting with someone there, and they were saying that from the 988, and this is anecdotal, so I don't know how often this is happening, but building on what Colette was saying and Beverly, people are transferring or giving the numbers to 988 callers to the peer support warm lines, and they may not be aware that somebody is not going to answer immediately. So if it doesn't have to be a warm transfer, as Colette was saying, there's you're running a center as well. And, everyone's got staffing shortages. So I don't know how we can try to eliminate that disconnect.
Develop the script with GCAL so that the staff at GCAL know exactly what to say, so they know where they're going.
Right.
And we do a warm hand off the in crisis. We're going to stay on the phone if they have to stay all day. But no, the call time is shorter, much shorter now. But yeah, we develop. So I think that type of collaboration is important.
But how sometimes, and I agree, Beverly, and I think they are aware, or we could make that recommendation, but also it's what people hear too. If they're calling, they're probably still, maybe anxious or what have you, and they're like, oh, there's a peer that I can talk to. You mentioned a peer, you just told me about that. That's great. And so it's just something, food for thought for the future.
Yeah, absolutely.
And I appreciate it, because it would be great if there was always someone available to answer the phone immediately. And absolutely. Jay, go ahead.
No problem. So oftentimes, historically, there seems to be a mistrust with individuals when it comes to the system, in a sense. And I know I'm one of those individuals. I did 18 years in prison, so I'm not the most trusting person when it comes to the system. However, I'm hopeful about 988 and its success, and I want to be a part of that success. So what would you tell individuals that are somewhat like me when it comes to kind of being, I don't really know about this thing, but as a recovery community, we don't want it to fail, because we do recognize and acknowledge that if it saves one person, then that's enough. So what would you all recommend or say to the recovery community, and what can we do to support 988 to assist in its success? Who want to take that one? That's for lottie-dottie everybody.
Well, I could say, I think one of the things, just trying to break the stigma, right? And I think one of the things that we're trying to do at DBHDD is to pull in those who have utilized 988, right? To share their experience, because me as a licensed professional, you may not receive it. Again, that's why the peer warm lines are so important, right? So to have somebody else share their experience with it, I think that's one of the things to help break down that stigma. I think, at the end of the day, as an individual, you have to really weigh out, like, do I want help, right? And how do I get help? I think the stigma or the reluctancy that's really out there is real. Absolutely, positively, hands down, right? We see it on the news, on the TV all the time, and we get it. And I think that's why 988 is so important, because we're trying to create a new system to address our needs. And I think people, you know, as Jean mentioned, 911 took 30 years to really get to where it's at, you know, today. And I think if everybody allows 988 to really work itself out, I think we will be the system that we need to be, to make sure that people who call and need the support and help are going to get exactly what they need. They're not going to feel like they are being dismissed or treated unfairly, that the place that they go to get help, they're getting the best care that they need. And I think, you know, over time, we're going to really improve that. But I think people telling their stories, right? Hearing your stories about how therapy or treatment helped you, I think that's the key to really get people to kind of step out and try something different and really utilize the services that are out there. Because you hear a lot of time that, you know, there's no this, there's no that, but there's tons of services out here that we just don't tap into. And I think it's really just about getting the word and the message out about what 988 is and what it can do for the individual, families, and communities.
Yes, anybody else? Because we're running out of time. We like to start on time and finish on time.
Sorry. I want to again go back to that diversity piece. The diversity and making sure that the services are available to everybody, but also the knowledge of the trainings and the certifications that are available. Reach out to those communities that don't look like everybody else to let them know that they too could be trained, so that those that are reaching out for services say, hey, I know that's available for me because look at who I'm looking at. I can see it, I can believe it. By me. And again, that recovery piece, speaking your recovery out loud and letting everyone know that they deserve long-lasting quality recovery.
Along with what Beverly is saying, culture, our culture got to change. It has to be more accepted. And you know, it's hard getting into the traditional things that we go through as a culture. And here we are, we got the chisel and we got the hammer, and boy, it's taking a little time to form that statue that we want to get to. But man, for me, I can just tell you this. I was afraid to acknowledge, I was afraid to do something about, because of the culture, the traditions that we have in society. I was afraid to go get this help that I'm now, you know, working for, because I didn't want shame to be about. The stigma was there and the fear was there. And so what we're doing and what we continue to do, to share this number, to share the benefits, to tell our stories, we are making a difference, you all. It's just one chip at a time, but we making that thing happen.
Yes, yes.
And be part of the solution. You know, if you know, instead of you know, jumping on social media and saying, yeah, that's, you know, it's horrible or whatever, find out, you know, what's going right. We learn that in CARES and all. What's going right? You know, there's share the strength on Nextdoor, your Nextdoor page, your, you know, TikTok and Instagram and all. You know, share the victories. Let's not focus, you know, and have the negative mushroom.
And thinking about that, Jean, thank you so much. We want to close out with hope and what keeps you all hopeful for 988. What vision do you see? Where do you see this going, and what keeps you hopeful?
And we remember we got about 3 minutes. So if you can use 1 or 2 words, if you can do it like a pilot, take off and land, then that will be helpful. So we can get out of here on time.
I would say access. I think that's my word, access.
Access. Somebody else, real quick. Access. I like that.
Focus on communities that are suffering, that BIPOC, LGBTQ, rural immigrants.
Yes, Bev, real quick, what you got, sis?
Staying intentional.
She said, stand intentional. Good.
No, I said, yeah, staying intentional. Yeah.
Being intentional. All right.
Being intentional. Wendell, give me a word or 2.
Just being focused on what the real issues are, because sometimes we are afraid to do that, but we got to stay focused. Stay focused.
Focus. Colette, give us 1. Keeps you hopeful. Colette.
Uh-oh.
Glad you froze. You probably saying
Well,
something.
Okay,
So,
well, I would say what keeps me hopeful is that we stay connected as much as possible. Can you hear me?
Yes, we heard you. Staying connected as much as possible.
Hello?
Thank you. So we
yeah,
heard you,
staying
Colette.
connected and peer support.
Staying connected to resources.
Thank you,
And
Colette.
definitely intentional peer support and supporting these peers as much as possible.
Thank you so much. Thank you all for being here. This has been an excellent panel. You all's expertise, I've learned a lot, and I'm sure everyone else has as well. Thank you all. Emily, it's yours.
Yeah, great job, y'all. Thank you all.
Thank you so much, everyone. Thank you, Jay. Thank you, Roz, and to all of our panelists for such a great discussion. I have put the SAMHSA required survey in the chat. Please let us know what you think and how this is going to affect your work and your knowledge. It really helps us to provide more great discussions and panels like this one. Please also remember that the third and final session in this Perspectives in Trauma series is going to be on December 8th at noon Eastern Standard Time. I look forward to seeing everyone there. That's going to wrap up today's session. Everyone have a wonderful rest of your Thursday. Thanks so much.
Yes,
Thanks,
our
everybody.
power. Good job, y'all. Thank you all.
Good job. Thank